Hi everyone. Today is, well, I guess it doesn't matter. It'll show the date, right? It's Thursday, September 30th. Okay, I wanted to talk about, first of all, I had an appointment with my surgeon again, and I got my tubes out. Yay! See? All gone. Yay. There's just little holes left. Oh, I'm really sensitive to the tape. Oh, bear with me. See? Just a little hole. It's pretty good. It's nice to be normal again. Same thing here. But the tape is still a problem. It's always a problem. Oof, that hurt. Yeah, he took it out. The most bizarre feeling ever. He says, take a deep breath. I did. And then I could feel him pulling this thing out. Now, I've had cesareans. So when they're taking the baby out, or when they're cleaning out the uterus, you know, the placenta and all that, you feel like this tugging on your abdomen, like it's pulling down. It was sort of the same kind of feeling, but stranger and very, very strange. Just pulling. And it seems like it goes on forever. Like, how big is this tube? I actually wanted to see it, but he had scooped it up and taken it away before I could look at it. I guess he figured I'd be all squeamish about it, but I really wanted to see it. Apparently the part that's inside your body has like, it's about this big, and it has holes all the way through it. So when it's sitting inside, it's collecting fluid from you know, the length of the tube, wherever the tube's sitting. So I had 2 of those in me. And when he started pulling, boy, that was a strange feeling. Strange feeling. I don't know if it hurt so much as it was just strange. Anyway, the other thing I wanted to talk about was dry skin. I mean, everybody gets dry skin from time to time, right? But I used to get it only once in a while, like really cold weather, or, well, no, that's it, just really cold weather, because I'd always drink enough water. But now I can't get enough water in. It doesn't, well, first of all, I taste everything in the water, so I can't drink tap water anymore. It smells like a swimming pool. It tastes like a swimming pool. It's disgusting. Just bleach. That's all I can smell and taste is bleach. So I'm drinking filtered water, but even then it's not as enjoyable as it used to be. Like my senses have become heightened. You know, my sense of smell and taste. I can really taste and smell just about anything now. So the water is not as good anymore, and it doesn't have that same refreshing feeling because of the size of the pouch now. It's sort of heavy and full right away. I don't know how to explain that. So anyways, I'm getting a lot of dry skin, so now I have to get into the habit of actually putting on cream and that sort of thing. As far as my stomach pain and general body pain goes, still having some stomach pain. It's gotten a little bit better. The other day I was driving and I hit a huge hole. Didn't even see it. And wow, it hurt. I screamed out. Thank God the windows were closed. I screamed in pain. That was brutal. But since that day, it doesn't seem to hurt as much. I don't know if the partial blockage was causing a backup or something, but from that day, things are just, they're moving now. There's no more diarrhea. It's normal bowel movements, and like, the pain is still there, but it's not what it was. Like, I'm not buckled over in pain when I drink something or eat something. It's sort of like a ow kind of thing. Anyways, so prepare for dry skin and little breakouts. Like, I have this strange rash on my face. Could be stress, surgery related. I don't know. Change in diet. I don't know. The other thing is that my weight had staled for I think about a week and a half, and I asked my doctor about that, and he said it's normal. It's sort of like the body goes through a cycle of I guess, survival mode where it holds everything and then it lets it go, and then it holds again and it lets it go. So it's sort of like you're readjusting every time. And he assures me that that will level out eventually. Not the stop and go, but when I get closer to the healthier weight, that'll slow down and sort of balance out in the end. The other thing I want to talk about was feeling full. Had a really hard time, and still have a hard time, understanding what full feels like. It's not the same. I used to eat to the point that it was like, oh, I'm full, I'm good. And now it's like, I take a spoonful, depending on what it is. The more liquid it is, I can usually take 2 tablespoons at a time. If it's more solid, like mashed sweet potato, couscous, because I'm still, this is at the month mark, so I'm just beginning to be introduced to solid foods. That's the way they do it in Ontario. I don't know if it's different anywhere else, but they take you through these different stages. So the first stage is pure liquids, pure liquid. Just, I think they do that to check for holes, sort of thing, and to take it easy on the little pouch. And then they move you to full liquids, which is cream of wheat, jello, milk, tea, things like that. And then it's puree, which I didn't do. I just gave myself the foods that they recommended, but I chewed and chewed and chewed until it was mush in my mouth, because there's no way I could get it in that way. It would just, oh, it wouldn't sit well. And now it's the full foods, solid foods, but still cautionary. Like they say, don't take pasta. Pasta's the only thing that got me to stop with the shakes. I had like shaky feeling. And couscous is great. It's tiny, 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 tiny. I cooked it in chicken stock, so that increased the protein in it. And other things like fish. Fish goes down really good. It tastes great, and it doesn't hurt when it hits your stomach. Anyways, I'm deviating from the point of my discussion. The feeling of fullness. So they say if you feel pressure just below your ribs, like where they connect, right? If you feel pressure there, stop eating. That's your full. I never got that. What I get is this sudden pressure right here, and I feel like I can't breathe, and I can't move it down, I can't get it out, and I'm pushing to get the gas to come around. I've noticed that I'm a big gas or air swallower. I'm working on trying to get around that, but I'm not sure how to do it yet. Anyways, I press and I burp and I pound and just to get it to move, and it comes all of a sudden. It's like there's no pre-warning to it. I feel fine, and then I have another spoon in my mouth and I'm chewing, and just as I get ready to swallow, there's that feeling all of a sudden. So stop, and usually spit out the food. Yesterday I threw up twice, and it felt better. It felt better to throw up. Cauliflower was the culprit last night. I couldn't get it down. It didn't sit well. Didn't sit well at all. So cauliflower's off my menu for a while. I was hoping to have a fondue this week. I think the girls would love it. They've never had one, and I haven't had a fondue since, oh my God, since my son was young. But I was thinking, in terms of eating, it's nice and slow. It's flavorful. It's tender, and it's fun. It's a good way to connect with your family. What else are you gonna do? You gotta wait and talk. So. Let's see, tubes are out, feeling full, thrown up, no feeling of satisfaction, stomach pain. I did them all. Congratulations to Faith KP, I believe it was, on her marriage and her pregnancy. That's wonderful, and thanks for sharing. And to my subscribers for your support, thank you very much. I really appreciate it, and I'm a fighter, so I don't go easily, but thanks. So, I'll keep you up to date. Bye.